If you're over 60, one common sleep position can double snoring and sleep apnea events tonight. And that matters for stroke risk. Stay with me for 5 positions to avoid, safer swaps, and a 2-minute home self-check before bed. I'm Dr. Thomas Frist, a supportive health educator focused on sleep and healthy aging. I translate research into calm, practical steps. Today, you'll get the 5 positions to avoid, who should be careful, safer swaps, and a quick snore risk self-check you can do at home. Here's our path. 5 avoid positions. After each, I'll explain why, give a simple swap, and an action you can try tonight. Stay to the end for a screenshot checklist and the 2-minute stop-bang self-check. That's number 1, then 4 to go. Quick pulse check. If this resonates, type 1 in the comments. If not, type 0. And tell me your city. I love seeing where you're watching from. Position number 1. Flat on your back, no head elevation. Why it may be a problem. On your back, gravity lets the tongue and soft palate slide backward, narrowing your airway. For many, that means louder snoring and more positional sleep apnea. Sleep medicine research suggests apnea events are roughly twice as frequent supine versus side for about half of people with apnea. Harvard Health notes, untreated sleep apnea is linked to higher stroke and atrial fibrillation risk via oxygen drops and blood pressure surges at night. Picture a garden hose. Lying flat is like stepping on it. Airflow drops and the pump, your heart, works harder. Who should be careful? Loud snorers, anyone with witnessed pauses, morning headaches, high blood pressure, atrial fibrillation, prior TIA or stroke, or those on sedatives or blood thinners. What you might notice: dry mouth, waking to pee, morning, fog, bed partner saying, roll over. Safer play. Swap to side sleeping with a long body pillow behind your back so you don't roll. Or elevate your head and torso 10 to 20 degrees with a wedge, or by raising the head of your bed 4 to 6 inches. Research suggests head of bed elevation can reduce snoring and apnea events for many. Quick quiz. If you only snore on your back, what's the first fix? Side sleep with a body pillow. Up next, your recliner nap might be doing something sneaky to your airway. Here's the tweak. Position number 2. Chin to chest neck flexion, stacked pillows or recliner slump. Why it may be a problem. Tucking your chin toward the chest, stacked pillows or nodding off in a chair narrows the airway even more. That can worsen snoring, apnea, and oxygen dips. In older spines with arthritis, it stresses neck joints and may irritate nerves. Picture kinking a straw. Bend too far, and nothing flows. Who should be careful? Hypertension, sleep apnea, cervical, arthritis or stenosis, heart disease, or frequent recliner nappers. What you might notice: waking, gasping, drooling, stiff neck, hand tingling, partner sees repeated head bobbing. Safer play, keep ear, shoulder, hip aligned. Use one medium pillow or a cervical contour pillow that supports the neck without pushing the chin down. Love your recliner? Add a U-shaped travel pillow and a small lumbar pillow so the head doesn't drop forward. Try the 30-second pillow. Test. Lie down. Take 3 nasal breaths. If your mouth pops open or your chin tucks, adjust until your neck is neutral. Myth check. More pillows aren't better. One correct height pillow is. Next, stomach sleepers. That head turn has a catch position. Number 3. Stomach sleeping with head sharply rotated or arm under head. Why it may be a problem. Stomach sleeping pulls the head into extreme rotation and extension. For most, that means a stiff neck morning. In some with neck arthritis or vascular disease, extreme rotation may irritate neck structures and, in rare cases, reduce vertebral artery blood flow. More commonly, it compresses the neck and makes nasal breathing harder. Think of twisting a garden hose near the faucet. You'll still get water, but pressure fluctuates. Who should be careful? Known carotid or vertebral artery disease, prior, TIA or stroke, uncontrolled hypertension, arrhythmia, significant neck problems, or on anticoagulants. What you might notice: neck pain or headache on waking, arm numbness, dizziness when turning your head. Safer play: transition to side or three-quarter prone. Hug a body pillow. Use a thin head pillow and a pillow between knees. Let your torso rest slightly forward, so you don't have to twist the neck 90 degrees. If you insist on stomach sleeping, try a very thin pillow or folded towel under the forehead with a small gap to breathe, keeping the head more neutral. Quick check: do you wake with a numb arm? That's a sign this posture isn't serving you. Coming up, the cozy fetal curl may be quietly shrinking your airway. Here's the tweak. In 30 seconds, I'll share the tip most people skip. Make sure you're subscribed so you don't miss it. All right, back to the part that protects your brain and sleep the most. Position 4. Tight fetal curl. Chin tucked, knees high. Why it may be a problem. A tight curl tucks the chin, compresses the chest, and reduces lung expansion. That promotes mouth breathing and snoring and, for some, more apnea events, especially with a soft mattress that rounds the shoulders. Sleep biomechanics suggest neck flexion narrows the upper airway, and smaller lung volumes make airways more collapsible. Try this. Slouch and take a deep breath. Harder, right? Who should be careful? COPD or asthma, sleep apnea, osteoporosis with kyphosis, heart disease, or frequent nighttime reflux. What you might notice: drooling or dry mouth, shoulder or hip pain, calf cramps from being too curled. Safer play: open fetal. Side sleep with the chin gently away from chest, knees slightly bent, a pillow between knees, and a small pillow to hug to keep the chest open. Keep your nose, chin, sternum, and belly button roughly in one line. Next, most people get this bed tilt backwards. Fix it, and snoring often drops. Position 5. Head below heart tilt, or foot up, head down. Why it may be a problem. Sleeping with your head lower than your heart, an adjustable bed misset or sliding down, can increase nasal congestion and venous pressure. Congestion narrows the airway, worsens snoring, and drives oxygen dips. The flip side helps. Head of bed elevation, about 10 to 20 degrees, can reduce apnea severity for many. Who should be careful? Hypertension, glaucoma, heart failure, cerebrovascular disease, sleep apnea, or significant nighttime reflux. What you might notice: puffy face on waking, stuffy nose, mouth breathing, sliding to the foot of the bed. Safer play: elevate the head of the bed 4 to 6 inches with risers, or use a wedge that supports the torso, not just the head. Aim for a gentle 10-20 degree head-up tilt. If you're stacking pillows, put them under the shoulders and upper back, not just under the head. Here's the promised 2-minute self-check for snoring and apnea risk. Stop bang. Answer: yes, no. S. Do you snore loudly? T. Often tired in the day? O. Observed apneas. Anyone see you stop breathing? P. High blood pressure? B. BMI over 35 or central weight gain? A. Age 50 plus? N. Neck circumference large, men over 17 inches, women over 16. or your collar feels tight. G. Gender male, score 0 to 2 lower risk, 3 to 4 moderate, 5 to 8 higher. If you're 3+ with snoring or pauses, talk to your clinician about a home sleep test. Sleep apnea is a big, modifiable stroke risk factor. Position changes help, but diagnosis and treatment, like CPAP or oral appliances, can be life-changing. The reflux versus palpitations nuance I teased. Left side often helps reflux. Gravity keeps acid lower. But some with atrial fibrillation feel more palpitations on the left. A 2018 heart rhythm study suggests left side positioning can change heart mechanics in some AF patients. If left side triggers palpitations, try right side or gentle head elevation and discuss with your cardiologist. What not to do? Don't. Tape your mouth shut if you snore heavily or suspect apnea. It can force airflow against a blocked airway and is not a treatment. Fix position, clear the nose, and get screened. What to do instead? 5 safer alternatives. 1. Side sleep with open fetal alignment. Benefit: keeps airway open, reduces snoring for many. How? Body pillow behind back, pillow between knees, head neutral. 2. Head of bed elevation 10 to 20 degrees. Benefit: less apnea and reflux, easier nasal breathing. How? Wedge under torso or forward 6-inch risers under bed legs. 3. Positional therapy for back rolling. Benefit: cuts supine time and can have events in positional apnea. How? Side sleeper backpack, small foam wedge, or DIY tennis ball, sewn mid-back. 4. Clear the nose. Don't tape the mouth. Benefit: reduces mouth breathing. How? Saline rinse before bed. Nasal steroid if prescribed. Nasal strip to lift valves. 5. Evening timing. Benefit: smoother blood pressure and reflux. How? Finish dinner 3 to 4 hours before bed. Avoid alcohol within 3 hours. Keep a consistent bedtime. Quick recap: avoid flat on back, swap 2, side or head up. Avoid chin to chest. Keep a neutral neck with the right pillow. Avoid stomach plus head twist. Go 3/4 prone or side. Uncurl the tight fetal. Use an open posture. Ditch head down tilt. Go head up 10-20 degrees. Do the stop-bang self-check. 3 or more means talk to your clinician. If this helped, subscribe for simple, actionable, science-backed health tips for 50+. Which swap will you try this week? Type 1 if you're in, 0 if you're not convinced.